So how do you address the idea that somebody might say, well, how do I know the care is as good as I would get? I know XYZ hospital. I know St. Mary's in there. I know they have the best staff there, and you guys are interlopers from out of town. How do you? I mean, some people will have this go through the back of their mind. I'm sure you've heard something similar. How do you address that kind of scenario?
Yeah. So first of all, I mean, I think the reputation of centers is not dependent on the center itself, but it's dependent on the surgeon, right? So it's the surgeon reputation that matters. And we already kind of handpick the surgeons that we want to work with. We've had many patients who have come get surgery by us. We have lots of testimonials and reviews. So obviously, word of mouth is, I think, the most important part of reputation for a physician. And I would caution against people saying like, oh, well, this, facility is great. There's many facilities that are well known across the country that patients travel to. And I'm not going to name names, but I've I've heard, stories about how the care was not as good as it seems. And I'm not saying like we're perfect, but the truth is there will be good reviews and bad reviews anywhere. But
Mhm.
we try to pick surgeons who um, have already stood out in terms of their work. If you look on our website, we want to model like excellence and precision from aviation, which is like my background, right? And surgeons who bring that to the table. We have quite a few surgeons who have a military background, which is very attractive, because those surgeons are usually very reliable and really meticulous as well. So and just because you're part of ACEs doesn't mean that you'll stay on ACEs. If the outcomes are poor or we have issues, then it's not a good fit.